terms of peer-to-peer learning, that's how we learn the best, because I think most people will have read evidence, that comes in very different ways. It could be in the news, it could be Apple News, it could be LinkedIn, it could be a variety of different places. But the value of peer-to-peer is learning from each other about what's working, what's not working. And I think the role of actually networking helps us as we leave here today. We're going to have way more people in our networks, and not just people, but we have a different perspective about what our partners do, and that's incredibly important. We get that through peer-to-peer. Yeah, so in terms of the implementations for virtual care in Nova Scotia, I've been behind virtual care in Nova Scotia. And so we have a technology, and what I'd like to start with is that technology, there was many good ones on the market, and we go through a diligence process. And the most important part of our diligence process is getting technology in the hands of patients and their families, and also our clinicians, because they're the real ones who are going to tell us if something works for them. So what we're using right now is for virtual care NS, which is access to primary care. We're using a technological solution that's to Maple. It's been changed a bit so that it's definitely Nova Scotia Health feel and look. And in addition to that, it can be on your phone, it can be on your computer, or it can be on your iPad if you have those. And if not, then we have ways for people to access it without those tools. Yeah, so there's a number, but probably the biggest that I would say through our innovation launchpad right now would be our robotics. And this is leading to our Robotics Centre of Excellence. So we have 5 robots in this province. And right now we're seeing not only the robotics in terms of making difference for patient care, but in addition to that would be the data that's coming from those. But we do have some other very big ones as well, like our command center and clinical trials and what we're doing in cancer care transformation. Yeah, so I graduated many years ago, and I spent many years in critical care. So I delivered care to people who were in a medical intensive care unit, which I loved. I went from there and I taught other critical care nurses, and then I went into academia. At Dalhousie University, I developed and continue to run an international research center. What I bring is strength from the credibility of my passion for working with people where they are, and also working with partners to come up with really cool ideas that can help to transform some of those big barriers that we've had in healthcare over the years. I would encourage them, and I think today, for instance, we've got many of our team who are here, but also we have many students who work with us, MBA students, Masters in Health Admin students, and so what I would encourage is to come. There's a lot of networking, the sessions are great, it's easy, accessible kind of place to be, and people are really sharing some important stuff.